Welcome to St. Louis on the Air. I'm Don Marsh. The most vulnerable of all of us are the most innocent and most unable to care for themselves. I'm speaking of babies, especially disadvantaged infants born at medical, economic, or environmental risk. That's when the organization Nurses for Newborns is often called upon to step in. It's been doing so through home visits during and after pregnancies for well over 2 decades. And here to tell us more about the organization and its needs is Melinda Oldemiller, the Chief Executive Officer for Nurses for Newborns. Melinda, nice to see you again. Thanks for coming in.
Thanks so much for having me, Don. I appreciate the invitation.
Tomorrow night's the big night. I know you're having a gala. We'll talk about that a little bit later. But give folks, if you would, Melinda, a sense of the people you help. Who are they?
So the folks that we serve at Nurses for Newborns are generally struggling in some way around their pregnancy or around the birth of their baby, but maybe not. Anyone who feels like they could use some support can access our services, whether they're pregnant or they have a new baby at home.
So Nurses for Newborns is a little bit of a misnomer because you get started before the actual birth in many cases.
We do. We've always served pregnant moms as well. And a few years back, in a research project with Washington University, we discovered something interesting about our data, which was that if we were able to serve a woman at least a visit or two before the baby was born, the ultimate outcomes increased. And so we have started really encouraging our referral sources to send moms earlier. And now about 50% of our families come to us prenatally.
How is the connection made? They come to you?
Well, we go to them ultimately,
sure.
But they find us. Families find us. The area hospitals refer to us, the social service agencies, clinics, individual doctors' offices, and then families can refer themselves. They don't need a doctor's authorization to come to Nurses for Newborns.
What kind of circumstances would a woman be in whereby she would be thinking, I ought to contact these folks?
You know, one of the number one circumstances is having a baby who maybe spent some time in the intensive care nursery when they were born. It could be a family that's experiencing isolation, that's here without family, here without relatives. It could be a young family, a young mom, a teen mom who's having their first baby and scared and not sure. Any family who is experiencing lack of resources, poverty, job loss, the families that don't have insurance because we don't charge families, so they can get services through us without having insurance. So it's a variety of things, but it all kind of points toward what are the things that help us keep babies alive and well during that first year of life. I
think there's a general impression out there that we're only talking about women in families that are economically disadvantaged, poor people. It goes beyond that, doesn't it?
It goes beyond that. About 90% of our families might meet someone's definition of not having enough resources, but we do have some families who come to us for some of the other reasons. One of the reasons might be that they are new to the country, don't understand or don't have experience with the American healthcare system, and need that kind of navigation. And you also have to remember that when a baby comes on the scene, it's urgent, and also the needs of the family just they quadruple when the baby comes.
How is all of this funded?
We have a patchwork quilt of funding. Our funding generally falls into a couple categories. We get funding from area charitable organizations and foundations. We enjoy the support of the community. We have many donors who help us with this work, understand this work. And then we also get funding from the state of Missouri and local governments, the counties. The home visits, can you give me a sense of what that involves, both during the pregnancy and then following birth? So all of our services are provided in the home. So we eliminate that barrier of transportation, because we can come to the family. And in the prenatal visits before the baby's born, we're going to be checking in on mom's health, making sure that she's connected, making her doctor's appointments, making sure preparations are in play for the baby's arrival at home, health considerations in the household. We're going to start some of our teaching modules on important topics, encouraging mom to breastfeed, for example, getting her ready for that. Then once the baby's born and is at home, we like to make our first visit as soon as we can. And in the first visit or two, we're going to do a couple things. We're going to make sure that nutrition is going the right direction. So whether mom's breastfeeding or bottle feeding, the nurses will sometimes literally side by side make bottles with mom to make sure that there's a lot of ways that can actually go wrong, which can be really dangerous for the baby. They learn CPR. They learn how to resuscitate their own infant, and every year we have several moms who do just that at some point using the skills that they learned in those sessions. They've performed CPR on their own infant.
The numbers that I've seen are really quite impressive. More than 100,000 babies have been assisted by nurses and families assisted by nurses for newborns over the 26 years now. I guess you've been in business.
That's right. We figure we're at a mid-sized city of babies who've been able to get the start, and we're looking at their health trajectory of setting it into motion in a direction that's positive. When a baby's health, nutrition, their own mental health, the well-being of their family, the mental health of their family, when all of those things start out poorly, it's very hard it's just that much more challenging to catch up.
Yeah. We did a program yesterday on postpartum depression. And listening to some of the stories and what goes on, and of course there have been some tragic instances recently involving that. I would think that nurses for newborns would be kind of the first line of defense against situations like this developing.
For over a decade, we have been doing depression screenings on moms at multiple points, not just one time, but both before the baby's born, as soon as we get there in the first couple of visits, and then at repeated points. And we're finding that between 35 and 40% of the women that we serve are screening positive for depression at some point during that first year. And that's concerning. And we are able to track it, watch it, make appropriate referrals, and get some of that early intervention going for families to avoid the tragedies.
I would have to guess that some of that depression is the result of exactly the kinds of things that Nurses for Newborns attempts to fix along the way.
It's often a complex mix of biology and the physiology of birth and the hormones that change in a woman's body, along with circumstances, sleep deprivation, stress, community level stress in the home, the stress of not knowing where your next meal's coming from, or how your bills are going to get paid, and all of those load in to mom's mental and behavioral health.
I was surprised to learn yesterday that men are subject to postpartum depression as well. That took me completely by surprise.
That can also happen. They may not have the physiological changes that women have, except that how it would relate to sleep deprivation, which happens to the fathers as well. But life often gets turned on its head. Routines are out of order. And also the demands for dad are exponential. And he may be splitting his time various places, just like mom is. So yes.
The nurses who go to the homes, they're all registered nurses?
That's correct. We hire highly trained nurses. Most of our nurses have spent time in the intensive care nurseries themselves. All of them have significant experience with infant care, and they are troopers. They go into every neighborhood, every city, every building in our region, to serve babies where they are. And they have a lot of passion for what they do. Many of them have spent many years in the hospitals worrying about what happened to those babies that went home.
Do they work solely for you, or are they affiliated with hospitals and spend just part-time working with nurses for newborns?
Most of our nurses are employees completely. They may work some shifts in the hospitals, but most of them are full-time with us or three-quarter time with us or with us. Yeah.
But you also have volunteers. What role do volunteers play?
We do. We depend on our volunteers. So one of the things that we do as part of our service, in addition to teaching positive parenting skills and making sure that babies' health is going well and assessments with the babies and that kind of thing, is we provide material support to families as we get it. So people in the community drop their used baby items, gently used baby items, off at our office, and then we have volunteers who sort, clean, and recycle the things that come in so that the nurses can take them back to the families that need them.
What about follow-up? At some point, the nurses have to stop visiting the homes. At what point does this happen?
Well, when we first start seeing a family, we go every week, and we start stretching those visits out. And at some point, we go to monthly visits so that we can keep tabs on things, and also have that important checkpoint for mom and dad to check back in at monthly visits. Unfortunately, we don't have the funding to circle back around much later than that. We are working on a project now to check in with families at the 6-month point and 1 year point if they've left service early or out into 6 months after they've left us, and we're going to be curious to see what that data looks like.
Melinda, how did all of this get started?
Well, we were started by a nurse, Sharon Rohrbach, who was a visionary, and she was a newborn nursery nurse at St. Anthony's Hospital back in the 80s, and she saw that babies were leaving the hospital healthy and coming back sick, leaving the hospital healthy and unfortunately sometimes coming back in body bags. And she talks about how you are just never the same after you have had to comfort a family who's gone through that kind of tragic loss. And so she wanted to use her training and her skills to make a difference in that time period. And she started us literally on her breezeway with her friends and family and colleagues helping to get Nurses for Newborns launched. And 27 years later, here we are.
And if my math is correct, servicing about 4,000 families, babies a year or so. How many nurses do you have to accomplish this? So
we have one thing that we haven't talked about is that we work in 2 states. We're here in the metro region on the Missouri side, but we also have a second office in Nashville, Tennessee. That we started in 2001 with the help of a football player from the Rams, interestingly enough, who got transferred to the Titans. And we started in Nashville as well. And so between the 2 sites, we employ anywhere between 25 and 30 nurses at a time. Who was the Rams player? It was Fred Miller. Oh. Yeah. Long gone. Yeah, long gone. Long retired from the NFL. Yes. We've got about a minute left. Tell us about what's happening tomorrow night, and if people want to become a part of that, what can they do? Well, we're going to be at the Sheldon tomorrow night, the fabulous Sheldon, for our annual gala, and David and Thelma Stewart are our chairs. Dr. Sessions Cole is going to be getting an award. He is a neonatologist at Children's Hospital. We're going to have a live auction, silent auction, and so on, and a live dance band to end the evening called Fat Pocket. And we have many generous sponsors. But if folks who are listening are interested in making a donation, or they can actually still attend the auction if they let us know today. We have a few seats left, and they can call our office before 4 o'clock. We will set a table for you. We will put all of that information on our website at stlpublicradio.org. Well, hope you have a wonderful event. Thank you so much. I should tell you, I'll be there, so I'll be looking forward to seeing you again and some other friends of ours. Fantastic. Thank you very much, Melinda Olemiller.
Archive versions of past St. Louis On the Air programs available for download or podcast at stlpublicradio.org/stlonair. St. Louis On the Air is produced by Alex Hoyer, Eva Hemphill, Lara Hamden, and production assistance comes from Aaron Dorr and Spencer Reed. The executive producer is Mary Edwards. St. Louis On the Air is a production of St. Louis Public Radio, 90.7 KWMU. Thank you for listening. I'm Don Marsh.
Support comes from the Missouri Forest Products Association, providing more than 41,000 jobs in the production of wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details at choosewood.com.